will be watching their kids play soccer or softball. And all employees and workers in all of our businesses are required to wear masks. Many of our businesses are requiring their patrons to wear masks as well by public health order. And then all of our businesses have the right to refuse service to people who are not wearing masks, who patronize their businesses. We should all be wearing masks in public. This is a plea for you to do the right thing so we can continue our gradual reopening and maintain the progress that we have made in our community, so our people can get back to work safely as possible. I understand the frustration. The pandemic has changed a lot of things that we do, but until we have a vaccine, we will be living in a different sort of way in the coming months. In St. Louis County, we moved quickly with our stay-at-home orders, and we've been cautious in our gradual reopening. This has allowed us to avoid some of the devastation that we've seen in other parts of the country. Now, with the spike in cases in the U.S., now is not the time to let up on our progress. Everyone should assume that they are a carrier of the virus. We know that many people who have COVID-19 are asymptomatic or are pre-symptomatic. Less than 10% of the U.S. population has been tested, and we cannot assume that this virus is under control or that we can relax our social distancing guidelines or reduce any of the collaborative effort that we have made so far to control the spread of this virus in our community. We are closely watching the data in St. Louis County. We don't yet see any reason or any trend that we could slow our pace of gradual reopening, and we are prepared to continue with that today. If there is a jump in cases in St. Louis County, we know more than we did 4 months ago. We have more testing in place. We have more masks in the community. We have wide acceptance of our social distancing guidelines, and we know we must continue to do those things. Our hospital systems have worked together in an unprecedented way. They are prepared with their policies and their procedures should we see more cases in the future. Through contact tracing, we are able to identify those who have been exposed. We are able to give them instructions to help them quarantine, and for those that don't have a place to safely quarantine, we have resources to help them. We have put together a nationally recognized model to take care of our residents in senior living facilities. That model has been adopted and is now being applied across the state of Missouri. At my media briefing on Wednesday, I'll have more specifics about the trends that we're seeing in the community, some of the patterns, and some of the things we can do to help prevent those trends. We are seeing more gatherings throughout the community, more weddings, more funerals, more anniversaries. And at these gatherings, emotions run high. There's a tendency to relax our social distancing. There's a tendency to want to hug folks and demonstrate our happiness to see them. Unfortunately, doing so greatly increases the risk of transition of COVID-19. The number of cases in St. Louis County is not yet what we consider alarming, but our health officials are watching these trends very closely. There are more cases of community spread. We are seeing more cases in young people, and we're seeing more cases that are work-related as people are returning to work. This is a long game, and we are preparing for the fall. We are preparing for what might be a second wave. We are increasing our inventory of PPE, and we know that we have more tests available. This planning includes our continued work with the hospital systems, our continued outreach in the community, and our extra efforts to protect those in senior living facilities and other high-risk environments. Our planning also includes changes within St. Louis County government to deliver our services more efficiently and more effectively, and we'll be talking about that in the coming weeks as well. All of the funds that we've spent on this pandemic are available to follow at our transparency portal at stlcorona.com. We have spent $9.3 million so far, and we have committed another $29 million. We have received $173 million in funds from the federal CARES Act stimulus grant. At this site, you'll also find COVID-19 statistics, the number of tests that have been performed, the number of those tests that are positive, and the breakdown of those tests by age, by race, and by sex. This site, stlcorona.com, also provides reopening guidelines, and I would encourage you to take a look at those as they apply to your business, or if you're interested in what you should expect to see when you're traveling around St. Louis County. My ask today is to be patient, be kind, be responsible, and wear a mask. The choices you make will determine how we stay healthy as a community. Thank you, and I would be glad to answer any questions.
How concerned are you about people not wearing masks as you move forward with the expanded capacity? Are you satisfied with what you've seen, generally speaking, in the community? Does there need to be more of it? And what's the concern going forward?
Well, the masks are required already by everyone who works in a place of business who comes in contact with the public. There are some places of business where masks are required for patrons as well, gyms, theaters, other entertainment venues. The rest of the businesses have the ability to refuse service to those who do not wear masks, who are frequently in their business. It's even more important now that widespread mask use is seen in St. Louis County as we start to relax these guidelines, as we start to increase capacities in some of our retail areas as well. So it's even more important now. We see widespread use of masks in St. Louis County, and we need to continue to see that. We don't want anyone to relax these guidelines. It would be a mistake to believe that because we are relaxing our capacity and we are increasing capacity in businesses, that also means that we should that we're okay, we don't have to wear a mask anymore, or that this is over. In fact, it's more important than ever that people are wearing masks, and we're seeing across the country places that had not previously required masks in various different businesses are now starting to require them, as we have.
You mentioned a second wave preparations going on for the fall. Are you expecting a second wave, or are you just trying to plan ahead? I know it's hard to look out that far, but what's your vision telling you?
Well, I think we have to be prepared. We are where we are today because we were prepared, because we moved quickly, we made tough decisions when they weren't popular, and it's put us in a much better place as a community to begin to gradually reopen our businesses, but we have to be prepared. We know what happens across the country. We have seen what happens when the proper practices aren't followed, when people reopen too quickly, or when there's not widespread use of masks or widespread acceptance of social distancing. We see what can happen. But so far our community has made very good choices, and we will be prepared moving forward. But as we start to congregate more, these social distancing measures are very important. Until we have a vaccine widely available, we have to understand how this virus works, we have to respect how it works, and we have to do what we know works to limit its spread in the community. If we don't do that, then we will have a problem.
If I may, one of our colleagues, Elliot Davis, has a couple of questions for you as well. He is hearing from North County mayors concerns about not enough transparency in the spending of those federal funds. Wanted to get your reaction to that, and also on those same lines, he has also heard some concerns that in general not enough is being done to help people in North County deal with COVID-19 in the way of testing and the like. Can you respond to those two areas for us?
Well, in general, we're in the middle of political season, 5 weeks before election, and I think we'll see a lot of exaggerations and interpretations of what's happening, or misinterpretations of what's been done. But the federal CARES Act has been directed at our most vulnerable populations since the beginning for months now in testing and in resources and humanitarian relief. And we will continue to do that. We're working very closely with our faith-based community, with our North County mayors, with the Urban League, to make sure those resources get where they need to be. So I can't imagine how anyone who's watching this closely would believe that those resources aren't going where they need to be in an unprecedented sort of way, and in a very enthusiastic way. As far as the transparency, This is the first time in county government we've ever had a transparency portal where the funding can be followed in real time, and we will continue to do that. The county council is participating in the expenditure of these funds, is giving us guidelines, and is reviewing the decisions that are made, and many times making those decisions together with us. And we have a very good working relationship. So as we get closer to August, I would expect more claims that really don't measure out in the data or the experiences or the facts, and that's just what happens around an election.
The owner at Herbie's just up the road let us know that there was a situation where someone tested positive for COVID there. They shut down for a little bit. Is there a concern that obviously with capacity going up, loosening some of those restrictions, we could see more of that?
Well, sure. I think it's important that people wear a mask. Wear a mask protects individuals who might have COVID and not know it from giving it to someone else. It also protects someone from contracting COVID when social distancing isn't possible. But we will certainly risk seeing more community spread if those social distancing measures and mask wearing aren't widely adopted. When we see spread in our community, most of the time that's a break in social distancing guidelines or a break in mask wearing, and we need more of that widely accepted. But we do believe we're in a spot now, watching the testing in our community, watching hospital admissions in our community, that we can safely begin to relax some of our restrictions on capacity, and we believe it's the right thing to do today. We're seeing a slight increase in community spread, but not alarming, and we know we can keep that in check if social distancing is continued to be followed and people are wearing masks.
That's what I was going to ask you on the St. Louis County numbers. I'm sure you've seen them. I think we had like 109 on Friday and then 92, I think it was Saturday, and then 60s on several days. Concerning but not alarming at this point. What's your characterization of that, and how worried are you about those numbers, if at all?
Well, we watch those numbers daily, as everyone does. We can track them on the statistics tab at stlcorona.com. And it's important to know where they're coming from, how many of those are coming from congregated living facilities. We are doing many more tests in our community, almost 1,200 a day on average. So we expect to see a few more positives. Well, what we really need to know is, are these tests a reflection of better testing and a reflection of what we already knew was here in the community, or are these tests a reflection of more spread? And one of the ways we measure that is watching the hospital admissions data, and we know if this is more spread in our community, then we will see that daily hospital admission number tick up a little bit. So far, the 7-day trend in hospital admissions is holding steady or slightly decreasing, and we'll be watching all these numbers very closely, and we'll make our public health decisions based on the data, based on recommendations from public health officials and our medical community and our doctors. Other questions? Doug, anything? Okay, thank you.